Hello, and welcome to ID Talk, Answers from Infectious Disease Experts. I am Dr. Scott Olson, a pediatric infectious diseases specialist at Banner University Medical Center in Tucson and Associate Professor of Pediatrics at the University of Arizona College of Medicine. Along with Dr. Nathan Price, I am the Arizona AAP Infectious Disease and Immunization Co-Medical Director. And if you're looking at the thumbnail of the podcast, Dr. Price is the fetching young man on the right, and I'm the one on the left. This podcast has been created to usually answer questions from our chapter members about anything and everything infectious disease and immunization related. We've taken the last few weeks off, so thank you for tuning back in. This is the week of April 27th, 2026. So this week we're going to have a little bit of a different format. We didn't have any member questions that were sent in, so it's going to be a little bit of a hodgepodge. I decided I'd go ahead and review a little bit what's been going on with respiratory viruses over the last several months so that we can kind of see what's been happening with each of them individually and how things have been changing in the last two respiratory seasons. So to get a better understanding of what's been happening in the 25-26 respiratory season, I took a look at the overall viral dynamics based on the National Respiratory and Enteric Viruses Surveillance System, which is freely accessible online. So looking back at the last several months, it looks like in the late summer or early fall, we had a bit of a COVID-19 peak starting in September of 25. Then late in the fall of 2025, we started seeing heavy activity of rhinovirus/enterovirus on respiratory PCR panels. I think it's important when we see those results that these are not the same viruses. It's just that the multiplex PCR can't distinguish between rhinovirus and enterovirus. But because they both can cause routine viral illnesses, it doesn't really matter too much to distinguish, but just remember they're not the same thing. Then in December and January, starting the new year of 26, we had peak influenza activity, with most influenza cases being H3N2 variants, and we'll talk about this a little bit later in the podcast. Influenza activity began declining in March, but it was still the predominant respiratory virus in the community. Then in February through April is when we started seeing increasing RSV activity. And while in April we started seeing declining numbers, I think we all have been aware that this has been a longer RSV season than typical, with prolonged recommendations for administration of monoclonal RSV antibodies to infants because of this prolonged season. Then it's also important to say that in March and April, there was also an increase in adenoviral activity in the United States. And while this was not the predominant viral illness circulating in the U.S., I think it's important to recognize that adenovirus can certainly present with high fevers and fairly significant illness. So if you've been seeing respiratory viruses accompanied by those sorts of symptoms in the last several months, it may have been adenovirus. So to quickly summarize what I just went through, in late summer, early fall, there was a peak in COVID-19, followed by rhinovirus/enterovirus. Then as we got into December and January, we started having heavy influenza activity, followed by RSV in February through April, with, again, a slight uptick in adenoviral activity also in the spring. I also went and did a little bit of a deeper dive into each of those respiratory viruses I just discussed. However, because we are still at the tail end of the 25-26 respiratory viral season, we don't necessarily have all of the epidemiology understood from this prior year. So some of the information that I'll be giving you guys does come from the 24-25 season, for which we have fairly complete data on most of these viruses. With regard to COVID-19, as I mentioned previously, we saw a peak of COVID activity in September of 2025, with declining activity since that time. Now, most of the viral variants we're seeing are still derivatives of the Omicron variant, with the XFG 1.1 variant being predominant in the most recent months. Thankfully, as newer variants have been emerging, because they all tend to be offshoots of the Omicron variant, against which our current COVID vaccines were developed, the vaccine does appear to have retained activity, so immunized patients are still fairly well protected against illness. When COVID circulation was at its peak in the fall of last year, test positivity peaked at 12%, which has now dropped to only 1.7%, and hospitalization rates in the fall were 2.6 individuals per 100,000 population, now declined to only 0.4 per 100,000, showing the significant drop in activity since the fall. And I think when we're discussing COVID, it's important to remember where we are now in comparison to the worst of the pandemic. So, for example, currently in the United States, for the first week of April, there were only 128 reported deaths from COVID-19, compared to over 21,000 deaths per week in January of 2022. So while we are still dealing with COVID circulation in the United States, we certainly are not dealing with the same severity of illness that was seen with COVID-19 at the beginning of the pandemic. Moving on to influenza, because we just finished the influenza season, there isn't as much summarized data for the 25-26 influenza season. But if we look at the 24-25 influenza season, we noticed that there was a significant emergence of the subclade K variant of the H3N2 influenza A virus, and it emerged as a predominant strain, accounting for about 89% of the H3N2 viruses that were characterized during that respiratory season. Now, the variant emerged due to antigenic drift, though vaccination did still offer good protection against more severe disease. Overall, 24-25 was a bad year for pediatric deaths, with 296 reported during that respiratory season, which was actually the highest in over 15 years. The biggest season for influenza deaths in the last several decades was 2008, when 288 pediatric deaths occurred from H1N1. In comparison, in 2020 to 21, there was only one pediatric death from influenza reported in the United States, and that was mainly due to COVID mitigation efforts that led to decreased influenza activity in the community that year. Similar to prior influenza years, about 50 to 70% of hospitalized children had an underlying condition, which means that about 50% of hospitalized children were otherwise quote-unquote healthy. Additionally, about 50% of pediatric deaths had no underlying condition, and about 80% of pediatric deaths occurred among individuals who were eligible but unimmunized during that influenza season. As I mentioned earlier, for the 2025-26 season, there's less information, but as of April 4th, the CDC reports that only about 49% of U.S. children were vaccinated, and for the current season, there's been a reported 143 pediatric deaths, most of them from influenza A. And when we look at how well the influenza vaccine was working in the prior season, interim data from this past year suggests overall vaccine effectiveness against outpatient visits of 22 to 34%, and about 30% against hospitalization, with higher rates of protection among children, at about 41% vaccine effectiveness against needs for hospitalization. And since we're discussing influenza, and there's been so much focus in the last several years on avian influenza, I thought I'd quickly review what's been going on with bird flu in the last year or two. So there was a lot of focus, obviously, because of concerns for possible emergence of a new pandemic strain. And in 2024-25, there were 56 total reported cases, mostly among agricultural or farm workers. The predominant avian influenza virus that was being identified in the United States was mainly a H5 hemagglutinin virus. And thankfully, in 2025-26, there have only been 2 novel avian influenza viruses that have been identified among U.S. individuals, one of them being an H5 variant and the other being an H1N2 variant. So it looks like with all of the focus in the last several years on monitoring agricultural animals for bird flu, it does appear that we're seeing decreasing activity this last several months. However, people will continue to watch this closely to make sure that we're not seeing recurrence of activity during the summer. Similar to for influenza, there isn't a lot of great summarized data for the 25-26 RSV season. But if we look back at the prior respiratory season that has full data from 24 to 25, we can see that there's been a significant reduced hospitalization rate compared to pre-pandemic levels, primarily because of widespread adoption of the new preventative methods, including maternal immunization and monoclonal antibodies for infants. Based on RSVNet data, hospitalization rates among infants 0 to 7 months declined by 43%, and in infants 0 to 2 months, hospitalization rates decreased by 52% compared to 2018 through 2020 baseline RSV data. And finally, when we're discussing respiratory viruses in the last several years, let's go from a place where we've been successful to somewhere we've been less than successful. Measles. I think we are all aware that 2025 was a disaster for measles control in the United States. So how are things going this year? Well, as of April 16th, there have been 1,748 confirmed cases of measles reported in the U.S. in 2026 alone, with 19 new outbreaks this year, accounting for about 94% of identified cases. Most of the cases that have been identified this year have been reported by 33 jurisdictions in 32 different states, including Arizona. When we compare these numbers to 2025, for that full year, there were a total of 2,288 confirmed cases of measles across 44 states, with 90% of cases occurring associated with 48 unique outbreaks. Now, in 2025, 11% of cases required hospitalization, with about 6% of them in 2026 so far requiring hospitalization, with the highest rates among those less than 5 years old. Thankfully, while there were 3 deaths from measles in 2025, none have been reported thus far in 2026. In Arizona this year, we have identified 65 cases of measles, most of them associated with an outbreak at the northern border starting in August of 2025, with 215 cases identified in Mojave County in northwestern Arizona. And this has all been frustrating to those of us in pediatrics because I think we're all aware that measles was declared eliminated from the United States in 2020. Now, based on continued circulation in the U.S. over 12 months, it seems likely that we are going to be losing that status. But because the meeting was delayed from April till November by the World Health Organization, we won't know till the fall whether or not we have lost that status of measles elimination. However, I'm going to say based on continued circulation and the number of outbreaks still going on, I think it's highly unlikely that we are going to retain our measles elimination status, unfortunately. And to that point, the Pan American Health Organization announced in November of 2025 that the Americas region had lost certification as free of endemic measles activity. So I think it's just a foregone conclusion that we're going to lose that status in the fall. So with measles surging in the U.S. in 2025 and 26, and it being in the lay media so often, how are we doing with our measles immunization? Well, unfortunately, we're not doing great. So according to the CDC, for 2023-24 school year, only about 92.7% of kindergartners had received both MMR doses, well below the 95% vaccination rate we target to maintain herd immunity. And if we look at Arizona specifically with this data, only 89% of kindergartners in Arizona have received both MMR doses. And when we look at why those kindergartners are not receiving immunization, the increasing rates of vaccine refusal have been driven primarily by non-medical, non-religious exemptions. So I think it's inherent on us as pediatricians and healthcare providers that we have discussions with our patients and our families about the importance and safety of immunizations, especially against things like measles, influenza, and RSV, which we know can make infants and children sick and lead to pediatric deaths. So that's our podcast for the week of April 27th, 2026. Thank you again for listening to ID Talk. AZAAP members can submit questions for future episodes to id@azaap.org. For more information and resources related to infectious disease and immunizations in Arizona, or to become a member, visit azaap.org. As always, thank you for these interesting consults, and we'll see you next time on ID Talk.